Today we are blessed with electricity. So we don't differentiate day and night because day and night is as good as us. But biologically night is for sleep. But there are a lot of hormone like melatonin which helps you sleep. Today we have a lot of trans fat, that is fried food, lot of butter, lot of cheese. They're tasty, so very bad. People put paratha and paratha ke upar butter.
I heard one podcast, in fact, where one of the doctor was telling that there was a study where they gave alcohol to a person and they deprived sleep to another person, and they made them to drive in a controlled simulation, and they found Hello and welcome to my podcast, The Healing Monk. I am Dr. Suman Das, your host. Before I go ahead in this episode, I would like to thank you for your appreciation for the previous episodes. One thing I want to tell you, friends, that just 10% of the viewers who have watched the previous episodes have subscribed. It may be a small thing for you, but for me and my team, the subscription is like a validation, and it encourages us to give you and bring you more and more interesting content. So please subscribe to the Healing Monk channel. Today, in our episode, I want to discuss about something very important. Let us say I am talking to you, you are listening and understanding. It's all because of the brain. Brain is the most vital organ of our body. But in the present day, which is very fast paced, lot of distractions, social media, automation, advanced technologies, there is lot of challenges we are facing for a good brain health. So here I have with me a renowned neurosurgeon, Padma Shri awardee, and decades of experience, who will take us through the ways that we can have a very good brain health. The topic will involve diet to have a good brain health, stress, having how to have good sleep, and many more. Let us welcome Padma Shri Professor Dr. Ashok Kumar Mahapatra. Welcome, sir.
Good morning.
Good morning. Jai Jagannath.
Jai
sir.
Jagannath. Jai Jagannath.
Thank you very much, sir, for accepting my request and coming on my show. Before we start our discussion, one question that I want to ask you, sir. In Hindi, like, dil bada hai ya dimag? Brain is superior or heart?
Brain is always superior. The heart is controlled by brain, and brain is also controlled by reversal heart. So there is a feedback. But if you look at the human genesis, when the embryo is only 10 millimeter, then 15 millimeter, then the first thing you develop the brain.
Sir.
When there are 8 cells after the fertilization, and you go to the 17 days of gestation, the brain is with few cells and they want to sit like a structure. And from 17 to 25 days, that sheet like structure elongate with different segment and they fold to a neural fold. So that what you know, that there is no heart there, there is no limbs, nothing. It is only the small cell number of cells which like a paper thin, and they fold to a neural groove and neural tube. And that neural tube is on 17 day is about 10 to 12 millimeter, and by 25 days about 20 centimeters.
So
20
brain
millimeter.
is like our root.
Absolutely. Without brain, nothing can happen. So that is what happens in the embryogenesis. Anything goes wrong pre-conception, and within 3 months of conception, we will determine the brain is going to be normal or abnormal.
So, sir, coming to the topic, what is brain health?
Brain health, that means how can maintain a healthy brain which make you functionally superb, intelligent, positive, constructive, and thereby keep you yourself positive and what is that called? Healthy. Healthy brain is
Healthy
healthy.
brain.
Brain is healthy body.
Right.
Because we have three parts: body, mind, and soul. When you talk of mind, generally we mean brain. Soul you don't see. So if you take the body is a temple, soul is the god, mind is the villain. So if the mind is negative, wrong, or mind is not working, is let us say no destructive or non-productive or negative, then entire body is going to suffer
That's true.
because it is all brain controls your indriyas. So in Bhagavad Gita say, indriyas are after body. Amongst the best indriya is the mind, and mind is controlled by intelligence, and intelligence is controlled by ego.
Yes.
So says Indriyana paro dehi, Indriyana paro manah, mano for dhi, dhi for swaha. So means ego, ahankar, abhiman. So the body upper mano achi. Above the mind is the intelligence, but that intelligence tell mind what to do and not to do. And over that ego.
Correct.
Everything is started by ego. That time when the ego takes over, your intelligence fails.
Correct.
Ahankar comes, then you forget everything. All your good to the go to the down because your ahankara come in, which is a negative aspect of life. Like Ravan.
Correct.
He had everything. But because of ahankar, so he has to kidnap Sita to see that entire family died. Everybody killed except Mandodari. Everybody's family died in the battle. So it is ahankar.
Sir.
And Ravan was a Pandit. He could, by his knowledge, his meditation, his power, he could get the blessing of Lord Shiva.
How we can actually guide our audience how to keep our brain healthy? What are the factors that we can
Most important factor is the disciplined lifestyle. Then good and sattvic bhojan.
Disciplined lifestyle in this sense?
Means get up at right time, do right thing in right time, sleep early, recharge your battery of the brain because if you work too much, what is happening today? People sleep at 2 a.m.,
Correct.
get up at 10 a.m. They never see sunrise. They never, people don't tell what is Brahma Murta. The best part of life, day is Brahma Murta. That means there is most positive energy, maximum oxygen in the environment. The breeze is quite healthy, and mind is positive because no distracting element in the environment.
Yes,
See, if you at 4 o'clock get up, everybody is sleeping in your house. Whatever you do, there is no distraction.
No distraction.
But if you work at 10 o'clock night, somebody calling, come, we are waiting for dinner.
Correct.
It's too late, we can have a cup of coffee and carry on after dinner. Let's all the other people are sleeping. The children are going to bed. So many things. Your wife can disturb you, your children can disturb you. If your daughter is there, it's so much atta, she says, Papa, jaldi so jayenge.
Even having rising early and sleeping early, that habit also takes good care of the circadian rhythm and the other hormones.
Absolutely, if you go back to the past, when there is no electricity, people are doing whatever they night is by candlelight or lantern, whatever it may be, putting ghee and solita, whatever. So, doing anything at night is more difficult. Today, we are blessed with electricity. So, we don't differentiate day and night because
Correct.
day and night is as good as us. But biologically, night is for sleep because there are a lot of hormone like melatonin which helps you to sleep. And if the melatonin destroyed because you didn't sleep, if you are not sleeping, that hormone will decay itself. So by 2 o'clock, if you don't sleep, then you cannot sleep, cannot have good sleep.
Cannot have good sleep.
Because the melatonin level has already gone up to 12 and slowly declined by 3 or 4. What the people do, they when the melatonin has got sleepy, they take coffee. They counterbalance the sleeping effect of the normal body and then want to sleep, the sleep hormone is not there. So they will go to bed, they become chatwat. They will not be irritated in the bed, they're turning around, they go and wash their face.
But sir, as a common kind of the common norm, we can say, like we tell our children, you study, finish up the work, and then it is very difficult for everyone to get up early in the morning, but they prefer to sleep in late. In fact, we used to study late 4 o'clock and something like that. and during from the childhood itself. So that habit is completely wrong, and
Very
it should
bad,
be
very bad. See, we divide the day into four parts. Brahma Murta. Brahma means Brahmin.
Brahmin.
Brahmin get up and finish the day, that is Dinacharya. Then go to Deva Murta. That is between 5:30 and 7. When you go to temple, you have the morning puja, aarti, prasadam, jo bhi hai. Then it starts Manav Murta. When everybody gets up, they're active, they finish their activity, go to office. They come back from office 5, 6, 7. Then they go to bed at 9, 10. So what happens? Brahma Murta, Deva Murta, Mana Murta. By the time 10, 10:30, half 90% world will be sleeping. 10% Ratrichara,
Right, right.
Nisachara. So they will be active after 10:30 or 11. So they will be sleeping 3 o'clock, 4 o'clock, which is just beginning of Brahma Murta. So they will sleep in Brahma Murta, work in Rakshasa Murta. So what we say, after 9 p.m., it will be Dana Murta. That means
Okay.
maximum negative energy.
Energy.
So most of you work in that time.
I sleep early, in fact.
No,
and,
but this is editing the that
yes,
throughout day you
yes.
keep on collecting data.
Correct,
You
correct.
edit and by 2 o'clock you send you the message. Particular news for next day morning, early morning.
Correct, correct.
That is the habit of the
Common people.
common
Right. sir.
news. Maybe print media or it is electronic media, whatever it may be.
So as we talk about sleep, so there are different
Type of sleep.
phases of sleep basically. So exactly what is the most important? How can a person have a good sleep?
Actually, people by and large in India do not consider sleep is a disease. See, probably sleep disorder is there in about 50% people in all over the world. So we say sleep is a very important of the part of the day, body's
Body.
life. Work and sleep cycle. When you
We
work,
recover.
when you sleep. So if you look at the John Hopkins, first time in the world they started in 1952 called Center for Sleep Medicine.
Right.
John Hopkins. So they have started doing sleep clinic, sleep pathology, sleep physiology, what is normal sleep, what is the brain EEG during sleeps. Then they have written a lot of papers and books. Then by 70 they started courses, diploma in sleep medicine, degree in diploma, PhDs, all this. Why we are talking that? As we keep on understanding more and more human physiology, we understood sleep is equally important than work.
Correct.
Because if you don't sleep, it's like a discharge battery.
Correct.
If you put on using discharge battery, it's going to work. That is what happened. Suppose I am operating throughout night. Next day, I have a very serious problem, I operate. But I would have done much better if I am not awake throughout night, so that I will not get irritable. I may do the operation well, that patient doesn't suffer. But I will be irritable. I will shout at nurses.
Will not be in sound mind.
No, the
basically.
question will be, you will be irritated. You will shout at
Our
nurses,
judgment also
junior,
will be affected.
junior, all this. No, with experience you adjust so that the patient doesn't suffer, but the people around you suffer because you are.
I heard one podcast, in fact, where one of the doctor was telling that there was a study where they gave alcohol to a person and they deprived sleep to another person, and they made them to drive in a controlled simulation, and they found that those who are sleep deprived, they are more prone to commit mistakes than those who are those who have drank alcohol.
See, actually, it depends on the what stage of alcohol drinking. Only first phase, it stimulates the brain.
So my point
So,
is basically
actually, you are sure the disturbed mind or sleepy mind is worse than a drunk
alcohol
person.
also, dope also.
If the person totally not drunk, not able to walk, not to control himself, then this is very bad. But if the person taken 1 or 2 pegs, no problem, because that is not giving intoxication.
But again, they have slept in the night.
They sleep in the night also.
So
no
this is just.
But I am only telling sleep as a disease.
Yes.
Even today is not recognized.
Not recognized
in India.
Even
So,
another.
So I started. For example, I started sleep clinic at our first time in Odisha. I started sleep clinic in 2012-13.
All India
So
Institute.
here,
Okay.
Bhubaneswar.
Okay.
AIMS has a sleep clinic. Sabdajang has sleep clinic. So we started here with a neurosurgeon, neurologist, physiologist, psychiatrist, psychologist. But I heard that they've closed down because
People did not
they
recognize
don't
and they
know,
don't
not
come.
people. Our doctors are not convinced.
Ah,
They will go to psychiatry rather than, and they say, why so much time? Why so many specialization? We have psychiatrists, we have medicine.
ah.
They go to medicine. If the medicine feel it is not our problem, they go to psychiatry.
Another thing, sir, I would like to talk to you is that, let us say I usually run marathons, and also whenever we run, I get up at 3 o'clock. So in order to get up at 3 o'clock, I'll sleep at
9:30 or so.
no, sir, by 7 o'clock or 7:30,
Okay.
I'll sleep. But to sleep in at 7:30, I'll take one Zolfres or
Hmm.
melatonin
Something.
tablet. What I found, I in fact track my sleep. What I found is that whenever I'll take the medicine, my REM sleep is zero.
Oh, acha, okay. So there is an effect on the brain electrical activities.
Yes,
So actually, this medicine, oh, we hardly understand many things. We take sedative or anti-anxiety medicine to cool down ourselves, but what all it does to the system, we don't know many things
exactly,
like.
sir.
Second thing, if I have taken blood pressure medicine, diabetes medicine, B complex, what people don't know, inter-drug interaction.
Right.
So if you have not taken anything, you have taken Zolfres, it has different action than if you have 10 medicine for different diseases and
Correct.
take an Zolfres.
Right, sir.
Because you don't know, even today, pharmacologists fail to tell 10 drug shortage interaction.
There has to be some trials to.
Absolutely, it's very difficult to actually which drug. So it requires a lot of dedication, money, and time, overall time.
Many people also, or even doctors, prescribe melatonin for sleep.
Sleep
Like
problem.
sleep, you're not getting sleep, take some melatonin, 5 milligram, 2.5 milligram. Some gummies are also available. Is it good to take that, or
See, the
it has
question is
got.
that by taking melatonin small dose, you will first regulate your sleep. It's like somebody's addiction, take him out of addiction. So here you are addicted to a different type of sleep pattern.
Hmm.
That you have de-addicted by using melatonin. So that you, if the person determined not to sleep, then it's problem. If he is mentally prepared to sleep, but because of habit could not, then if you give small melatonin, he will start sleeping.
Ah,
As he, the cycle of sleep and working rhythm change, his body clock changes. So after some time, maybe 10-15 days, you stop melatonin and ask him to do physiologically. So our aim is to get the body back to the rest, derailed,
correct.
to get it back to the rail, so that the physiology take over when the melatonin stops.
Okay.
Otherwise, what will happen? You cannot continue lifetime long melatonin.
Our body will stop
Body, because they are all
secreting
receptor
melatonin.
based. So any medicine you take a longer time, it will be ineffective, or there is chance of more and more increased doses,
Correct.
which may be toxic
To
or
you.
have side effects.
Correct, sir.
So that is not advisable.
Coming to the other aspect that you told, like diet, healthy diet
Absolutely.
for a good brain health. So how exactly, what are the good.
See, actually, from very Satya Yuga, or in when the rishis were saying ashram, they are habituated to have Satyuga food because they were going through the scriptures, Quran, Shastras. They were not in a stage of irritation, excitation. They did not require a lot of energy. So they took Satyuga food. As for Bhagavad Gita,
What exactly sattvic food
God, Lord Krishna had told Arjuna what is Satyuka, Rajasa, Tamasa, chapter 17 of Bhagavad Gita.
sir?
They say that it's bland, sweet, energy producing, and testing, good testing to test, and it has longevity will be increased, vitality increase, intelligence increase, buddhi, dhi, gyan, pragya, and healthy life, good life, long life, and happy life. For everything you require sattvic food. And what is rajasiga, which give you energy?
Okay.
For the for the people like fighters, you cannot have sattvic food and go fighting because that won't give you too much of calorie, too much of energy, and it should raise you that your blood become little
Correct.
heated up, so that your body is prepared for fighting. That is what is kshatriyas, warriors, kings. They should have rajasiga that contain a lot of spices, oil, fat, so that instead of 1,000 calorie food for you, they will have 3,000 calorie food.
3,000 because they are warriors.
Warrior, they require
They
food.
require energy.
Then tamasika. Tamasika is nothing to do with the sattvic rajasic. This is putrefied food. You keep the food for 3 days in the fridge and take it, which is too much of pungent, too
Correct.
much of sour. It partly rotten. Fruits are partly सड़ गया है, कुछ खराब हो गया. So this is tamasika which you give neither help you in the energy, nor in the positivity, not in the longevity of life, or the life which is out of disease.
Correct.
So if you take tamasic khana, it will be very bad for health, not for good for mind. Your intelligence, positivity will not increase, and you may suffer bodily. Suppose half rotten banana that has bacteria. You don't want to throw it because so you eat it. So next day you have stomach irritation,
Correct.
a little diarrhea. You may say, "Kya? Nothing has happened," but it will definitely change the balance of the body physiology if you take
So, like we talk about nutrients like supplements,
micronutrient.
micronutrients and supplements. So, like omega-3 fatty acid, many studies are there which increases the brain activity, function, so cognitive functions, etc., memory, cognitive function. So, are they recommended usually?
Absolutely. If you are not doing well, suppose a student is brilliant, and then the time came he is not coping up. Up to 10th class he was getting 90%. As soon as college is not, the environment is different, teaching process is different, no teacher student relationship, so he declines. If you give omega fatty acid, it may have performance, but then that keeps the body healthy because it reduces the bad cholesterol and make the blood flow. So if you look at the children now, children below 40 years, 40% obese,
Right.
30% normal weight and 30% underweight. So that a child already those are affluent family has gone to obesity at age of 14, 15.
Correct.
They come to me many times with 30 years or before 30 years they have overweight problem, diabetes, blood pressure. So overweight mother of all diseases. So one has to take balanced diet, not high risk fat diet. Today we have lot of trans fat, that is fried food, lot of butter, lot of cheese.
They're tasty, so
Very
people
very
will
bad. People put paratha and paratha ke upar butter. Both tasty, but they will be round within 15 years.
Correct. So another thing is like some Ayurvedic medicines like ashwagandha, I think Arjuna also, ginseng. They are also recommended. Do you recommend that? Even
Very much,
turmeric,
very much.
turmeric.
See, if you look at the Satya Yuga, the allopathy medicine is about 300 years old
Correct.
at best.
Right.
And if you homeopathy medicine by Hindman, it is 19th century, 200 years old. But if you look at Ayurvedic medicine, it's from Dhanvantari.
Right.
Dhanvantari came out from Samudra Manthana with a Amrita Kalas. Amrita was nothing but that nectar which gave you immortality and good health. So we know, as for Hindu mythology, that if you use herbal products and their medicinal plant can make you healthy, happy, intelligent, positive, and without any disease. So I believe 100% that this what you are talking about for a healthy life, you should not take any medical treatment. I, with my experience, 55 years, I think 70 years people are taking 10 medicine. Two for diabetes, two for blood pressure, one for sleep, one for constipation, one for backache, like that. At 80 years, they are taking 15 medicine. One or two medicine for prostate cancer, then one more for any COPD. So how you can get out of it? Mahatma Gandhi in 1940 talked to Dr. D.S. Mehta. D.S. Mehta, just Mahatma Gandhi suggested that we should have naturopathy institutes. And it was D.S. Mehta who took it over. And they started a naturopathy institute at Pune, National Institute of Naturopathy.
Right.
Dr. Mahatma Gandhi wrote a book called Nature Cure.
Nature cure.
Nature Cure. That book was published in 1940. He talks about cold therapy, heat therapy, mud therapy, mantra therapy, and Ramnam therapy. We many times say, what is the impact of mantra on human mind and body? Many times in Ayurvedic college, ISKCON, Hare Krishna, Hare Ram, we talk about mantra and healthy body. I believe mantra is very, very good for the healing because that produces positive vibration.
Correct.
Omkar is for the Lord Vishnu. And the most positive, most healthy, most vibrating mantra is Om, Om,
Om.
Aum.
Correct.
Second mantra is Mahamrutyunjay. Third is Gayatri. So if somebody practice early morning Gayatri, that is for Lord Shiva, and throughout 24 hours, anytime you get, you have 2 minutes at midnight, so Om, Om, 1 minute. And Mahamrutyunjay is dedicated to the Pradosh time. It is half an hour before sunrise, sunset, and 1 hour after sunset. Basically between 5:30 and 7. So if you divide the day, three parts, morning part, evening part, and third day.
Throughout day.
So Lord Vishnu is prevailing all the time. So you can do mantra. Omkar mantra कोई timing नहीं है. You have can Omkar at any bed, at bath, at bathroom, doesn't matter. But when you talk of Lord Shiva, it is usually in the evening. And Gayatri mantra in the morning because night there is no sunlight. So that is how we believe these three mantras can make you perfectly healthy.
Even as we are talking about the mantra and meditation, so how the meditation helps in improving our mental health and stress-free life?
The three type meditation: silent meditation, japa meditation, and mantra meditation. Silent meditation is best. That means you keep silent, control your mind, and try to concentrate at the between the two eyebrow and the forehead. That is how the good yoga means that you keep silent, cross leg in a kusasana or anything, a bit of asan. Asan means seat of cloth where you sit, and then practice meditation. So silence is the best thing. If you cannot silence, japa. Japa means you mutter the name of one God, Lord Krishna, or Hare Krishna, Hare Krishna, Hare Ram. You know ISKCON temple. While walking also they have mala, Hare Krishna, Hare Ram.
Sir.
So that also gives you solace. While the mind is elsewhere, you can still keep on doing some japa. That is japa. Mantra means you keep again silently and utter mantra. Om, 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 or Namah Shivaya, Namah Shivaya. That is not japa, that is mantra. Japa is Hare Krishna, Hare Krishna, Hare Krishna, Shri Krishna, Ram, 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 Ram. This is japa. You are uttering the same name repeated again and again for hours. So, if you ask me what the best, silent meditation. Second, japa meditation. Third is mantra
In
meditation.
fact, one this paper I was seeing, they did this chanting of Om, and after that they did the EEG, and they found that the EEG is more stable than before that. So
There is no excitation of brain.
there is no
Brain has
excitation of
cooled
your
down,
brain.
and these are delta waves instead of theta and beta waves.
Correct, sir. Correct, sir. So,
This is all proven. It's a today we know a lot more brain physiology than 50, 30 years back. Because all understanding of brain is only 200 years old. So in that 200 years we started anatomy, then physiology, then electrophysiology, then finer things like now 20 years we are talking micronutrient, manganese, copper, selenium, zinc. We are not talking about micronutrient before. हम लोग vitamin खा लेते tablet.
sir.
Today each vitamin called fourth.
Right.
B complex for
Exactly.
C.
It will be
Why?
additional
Because they are
factors.
all added with micronutrient.
Sir.
And what these do? The finer brain function is done by micronutrient.
Correct, sir. Sir, as we are talking about the anatomy, I feel very fascinating. Like patients with GBM, where a big part of the brain is removed, and they come to me for radiation. But the beauty of the our brain, our other parts of the brain, is that though we have removed a part of the brain, maybe especially in the non-eloquent areas, still the person is completely normal many a times, and sometimes we see them, they have some kind of symptoms. How does that happen?
You see, actually, we did a beautiful study. When I joined neurosurgery in 79, my professor said that we will work on glioblastoma. And I had a master chart of large sheet, 1 meter sheet, because those days no computer. So every patient. So we decided glioblastoma surviving 1 year or more, we'll study them. And I had collected 300 patients from 79 to 85.
300
300.
patients, my
And
God.
we found out what happens to them. Anybody surviving 1 year or more can recurrence, will reoperate them. That is the time we had a professor of neuropsychology, Dr. Khandelwal, who was trained at PGH and came. So we said that you have to study every patient before surgery,
After surgery.
battery of neuropsychology, behavioral science.
Ah,
So he did a search, write up, and then post of 3 months, 6 months, and 1 year. So he found all these patients. What you are thinking? Let us say patient came in coma.
right.
We have operated. He had no evaluation in neuropsychology before. We are very happy that he is recovered. He survived.
Ah,
He leading like anybody will take food, will do work, all this. But if you do the psychology, they're totally damaged.
okay.
Acha, if he has not gone on radiation, the whole brain radiation, he is still better because it's surgery, radiation, chemotherapy, all damage normal part of brain to some extent. But because to save life, we resort to this method. So if you ask me, if a person can be controlled by surgery alone, will you go for radiation answer? No. Because that is also harming.
Yeah, that's like grade 1, grade 2. We don't
Not all,
operate.
many things like that. Previously, every pituitary tumor, craniofaringeal, we
Yes,
are
yes.
giving
With
radiation.
radiation.
Today
Now
we don't give.
don't give.
We say rather if he recur after 5 years, we'll reoperate it. Because
In
that
fact,
radiation to a child will damage hypothalamus. And
but again, sir, it's as a radiation oncologist, again, we will see the survival. If we don't radiate, again, the chances of recurrence is high.
देखिए,
Like
see, we,
medulloblastoma.
I don't know, you know Dr. Singhal, RM Singhal.
Uh-huh.
We had done a lot of study because he was my neighbor in early 80s. So we decided to study craniopharyngioma. They had a Dr. Sharma. Urmil Sharma was the first professor of radiotherapy at AIMS, Delhi. Joined 1963. So we all understood to get something, you have to lose something. You have to extend the year age by 3 or 4 years.
Correct.
You have to compromise with the cognitive function. So cognitive function, what is the cognitive function? Could these children, those who operated at 5 years of craniopharyngia, go and have a degree, become a doctor, or engineer? I do not know study in the world.
Sir, but I'll just differ in this. In the present day, sir, like suppose we are treating whole brain also, we are doing hippocampal sparing, and so that is to prevent the cognitive functions. And I have a patient whom I had treated with craniospinal radiation. She was, I think, 13 years at that time. She is now surviving, I think 23 or 25 now, and she's going to marry. So, in fact, what I would kind of tell is that there is a kind of optimization, like what is the best required for that particular disease, and we have to follow that.
That is why the IMRT has come.
Yes, yes,
Intensity
exactly, sir.
IMRT
IMRT
has
after
come.
that has come.
Stereotaxy radiosurgery has
Yes, sir.
come.
Yes, sir.
If I have to only radiate only 1 centimeter brain, I will not go for whole of the brain.
Exactly, sir.
So this is we have learned from our experience.
Correct, sir.
If we would have gone to 90s and 80s, we are as an ignorant person, we are giving radiation to brain. Now the radio biology came,
Radio biology has come.
radio
Yes, sir.
pathology came.
Yes, sir.
When the people died after radiation, they found huge amount of damage to hippocampus, rest. So you are protecting the part of the brain which is maintenance the limbic system, so that the memory, intelligence.
So now actually during when planning the radiation, uh, the the system has improved so much that we will do MRI, we will exactly
Find
localize
out
all
the
the parts, and these parts like brainstem, let us say, or optic nerve, optic tract, they will be given
protected
first preference than the tumor,
tumor. Yeah,
than the
absolutely,
tumor,
absolutely.
to because yes, quality of life is
Life.
very important. So over the period, even like radiation has also evolved like anything, but we still have
Naturally,
that fear.
we are giving those as cobalt therapy.
Ah, sir.
Today,
Now
things
the
have linear accelerator,
yes, sir.
gamma
Yes, sir.
knife, X knife, cyber knife. So our science and our knowledge both have helpful for
Improved.
the quality of life.
Right, sir.
It is knowledge-based science and the technology. Today, the technology is 100 times better than what is 30 years back. 30 years back, nothing. 40 years back, nothing. We have small cobalt machine, cobalt 60, and irradiating whole brain.
So
Today,
as we are talking about the technology, recently there was the neural link Elon Musk, who is a eminent businessman of
Neuronal
US.
network.
Yes, sir. So, how do you say that Neuralink chip they will place one in the brain and that will help the
I
brain
think
person?
I
I think
think
it's
ti-
in the one
I
person
think
has been done.
I think time will come. Lot of microchips or neurochips or neural networking going to work. I think 20 years back, I was reading in MIT. Somebody hand was paralyzed, brachial plexus. They wanted to make the upper limb function. They had microchips for everything. For this function, they used 64,000 microchips for simulating the entire hand.
Yes.
Then also they were not taking fine work. So
Okay.
I am sure the science will come, our health electronics, so they will be able to put chips in the brain because I was hearing it lecture by MIT professor, I think Atul Sur, maybe somebody. He was talking neuronal networking influenced by the microchips.
Okay.
Suppose the one part of brain is disconnected another part. The stimulus is not going. If you connect by the super stimulus, by putting a electrode or chips,
Something.
then the conduction defect between two parts of the brain will mitigate and the brain will start functioning. So what happens really when there is part of the brain damage or partial damage, it is not going to get input from the other system. That input further prevent the activity of that area. Your brain is partly damaged, but that damage has prevent some connections. If that link can come
There will be
back,
some kind of regeneration also
it is
from the other parts.
it is the link between the functioning and partially functioning.
Right.
So the partially functioning part of the brain can make to work better function by relinking the normal brain.
It's kind of a adaptive
It is a networking.
reinnervation.
It is a connectivity. So you are connecting one person to another, one place to another place. So this thing is going to happen. I'm sure in 20 years' time,
Yes, sir.
maybe in our lifetime, another when you will become 85, 90, you'll see these things. Because science is very rapidly improving.
Sir.
What is happening today? See, I will tell a very beautiful story. In 1948, one scientist who writes fiction in UK, he wrote Man Will Be in the Moon. The book was Man in the Moon. So everyone laughed at him in England. He was so much harassed, humiliated that he had to leave London.
Kind of bullying.
He left London because he said it's not possible to stay.
Yeah.
Everyone telling him, I am mad. Man in the moon, what is going to happen? So he went to Sri Lanka and stayed in Sri Lanka. I think Sri Lanka. And in 1968, after 20 years, man was the moon.
Man was in the
So the question is that you have to have that third eye, which you can see the incoming event after 20 years.
Correct, sir.
Okay, it's like Abhimanyu in the mother's tomb could know after 14 years of his birth,
Yes.
he knew that what is
Chakravyu. What is the Chakravyu? In fact, in the present day, we are in a Chakravyu of social media and all that. Sir.
Absolutely.
How do you advise our viewers that how they can come out of the addiction of the contents and social media?
I was outside for 1 year. One of my friend, his son was addicted to computer. I'm talking 1998.
98.
99. It was a new small computers had come and he was a brilliant student who was interested in engineering but addicted. So question is that again you have to control your mind. Mind is a indriya, karmendriya. If the mind is out of control, you get addicted. Whether it's smoking, alcohol, not sleeping, everything. So I would suggest if you are a perfect man, you will not get addicted to anything. Neither to the even study is addiction. I'm throughout night I'm reading the novel. Addiction.
Addiction.
It may be positive or learning something, but that you can learn daytime. Why at throughout night then sleep throughout the day? So addiction is a part of uncontrolled indriyas. So that is I think you must have read that time. Chanakya told Apada Kathitam Pantha Indriyana Asanjamaha Tajaya Sanjaya Margam Jenastha Tena Gyamatam. That means if you are out of control of indriya, you are going to suffer. If you control them, you can be successful in every field of life. So whether study, whether it's computer, whether it's cell. See, Americans are using cell phone for 6 hours, and we are using 5.5 hours and second in the world. So wrong thing we have picked up fast. But we are not thinking how much honest are Americans, how hardly work, I mean, they work very sincerely for their country. That we don't learn. But American using cell phone will use cell
Will
phone.
use it.
So the wrong things are picked up much earlier and far better.
In fact, that also affects sleep a lot. People see
Absolutely.
this blue
See,
screen.
that is the reason we did a program on cell phone tower and cell phone and human body.
Mm-hmm.
It was in 2001. Nagpur High Court and Bombay High Court. There are public interest litigation that people are putting cell phone tower
Cell phone towers on
on the rooftop.
rooftop.
So it was sent to the Minister of Health. The Minister of Health make a committee. So there was one CGM of the telecom, NTML, and I was a member from AIMS, and one is Director of Health of DGHS, Director of
Right.
Health Services. So we found out the cell phone tower regulation. We could found American regulation, European regulation, Chinese regulation, Japanese regulation, no Indian regulation. We are using cell phone maybe from 98,
98, sir.
99. 3 years have gone, 4 years have gone,
We still using, but
and people are telling why the India doesn't have cell phone regulatory
Regulatory act.
authority. CGM did not know if you put a cell phone tower on the top, why people are putting cell phone tower. मेरे घर पे मैं 3 लगा दूंगा तो
I'll
मुझे
be more connected.
no, I get 15,000.
Ah,
One those days, each company paying 5,000 for cell phone tower.
Cell phone rent.
So if I put 3 cell phone tower of different company, I'll get 15,000. But what we do not understand, people do not read. They have sleep problem. Student cannot do their activities. The brain will be always constantly in a radio waves. It's collecting radio waves. So much of radio waves that will disturb your body and brain function.
It's like
Absolutely no problem.
it's like taking one cigarette every day, and after 50 years you get cancer.
This is what is happening.
Correct.
That is the time when they are talking this vibration cause cancer. And the 3 reports of vestibular sonoma, hearing now tumor, but subsequently they disprove that they may not be
That may not be
connected.
linked. I went
But
through
what
that,
is true that if you have a high radio frequency wave around you, you will be disturbed physiologically.
Obviously, sir. Exactly. When
See,
there
this
is
is not only that. A cell phone tower, your microwave at home for food, and your new fridge and all this, which are using a lot of technology.
It's like, sir, people are more concerned about what will cause cancer, what will cause some big diseases, but they're not
Bother
understanding
for the
that
behavioral
problems, sleep,
cognitive problem.
cognitive problem.
That I told you, sleep is never recognized disease in India,
Yes,
even
sir.
today.
Sir, before we end, I would like to talk to you about the most challenging surgery that you have ever done. Was it Jagabalia or anything else? Is there?
Many are like that, but let's say Jagalia is the most challenging because there are only 12 cases in the world.
Right, sir.
We have large AVMs in the brain. I remember 3 cases, very important cases. One of my junior, I was professor. It was 2002 or 3, I don't know, remember. One of my junior was operating AVM. Okay, he started morning 8 o'clock, so incident 10 o'clock daytime, and at night 10 o'clock he called me because I was doing pediatrics. So he called. I got a call from the OT. Sir, the bleeding is not controlled. Okay, I came there. So I tell what is happening. He says, sir, bleeding. Well, how much you lost? 7-8 liters. I said, don't do anything. Don't even close the dura. So I say, you go and take a coffee and sleep maybe a side room. I went there. I said, today day is over. We'll stitch one layer, dura, muscles, skin, one layer. I say, he has 7 liters. He's unstable. Let him take to ICU, stabilizing. If he survives, then something next.
Oh,
So 2 days we stabilize. He wake up. Then we have second operation.
okay.
That tumor could be removed.
Oh,
Another operation my professor was doing. That is 90s. I was that time associate professor, additional professor, I don't know. It's a glioblastoma of temporal lobe in a 14 years old child. So the child has bled about 2 liters. It was started at 10 o'clock morning, and at 3 or 4 o'clock he was upset, so much of bleeding. So he called me. So what is the problem? He said, I am very upset, the child is bleeding. I said, close it. He said, no, so much of bleeding. The bleeding will stop. So I said, sir, you are tired, you come out. So I went there, to a sponge. I said, I'm putting the sponge inside and closing, and wrote that sponge will be removed tomorrow once the bleeding stops. You see, we know when tired, you struggle. More and struggle, more problem.
So basically, patience is
You
the key.
patience and take a decision. What we sometimes do, if a large tumor, vascular tumor, stage it, or get lot of blood, control the blood pressure to 70, so that the intra-arterial pressure is low, and do it. So the time came that we have lot of blood. Why should you give hypotensive anesthesia? So the hypotensive anesthesia which came in 80s disappeared by 2000.
Right.
They say no, we have much better drugs. They know hypotension. So then we are losing thinking. So many things are like that. There's
One,
another operation I was doing. I was doing a patient of meningioma in the third ventricle,
Okay.
tentorial meningioma. That was that time, GP Korala, the Prime Minister of Nepal, was admitted in cardiac surgery, and he had angioplasty. So I was operating 3 or 4 liters of blood. It was 6 o'clock evening. So Dr. Venugopal came,
Cardiologist.
cardiac surgeon.
Cardiac surgeon.
She came with Manisha Korala.
Mansa Koral.
So I was operating. I looked there. He said, what you are doing? I said, "The vascular tumor is bleeding." So the floor was there, bottles are full, all this. A bottle which have a lot of suction fluid, saline. So half of the bottle will be blood and half will be saline. So they say, she told me, is it bleeding too much? I say, it's a very vascular tumor. So why did you operate? I said, if you don't operate, he will die. If you operate, he may survive. Say, do you have really every patient bleeding there? I said, no. This may be 1 in 1,000. And unfortunately, that 1,000 time,
Has
what
come
happens,
to
you have come. So she went left. So and that was around 6 p.m. 8 p.m. I said, okay, nothing will do. We'll just stop and put something inside. So that resident who was assisting me is a professor in, I think, Liverpool, pediatric neurosurgery. So we stop it. We say we'll take him to ICU, and after 48 hours we'll open it again. See what is happening. We have not closed the dura, so whatever blood will come out. So we do that. After 48 hours, when the patient open eye and all this, we thought then we'll operate next tomorrow because too much of delay will help. Huh? So third day we'll took him, take out whatever clot and take out little gauze piece whatever there, and the bleeding has stopped. Then we'll close the dura. All this. The question is that if small tumor is left, it is better having surviving patient
Correct.
and not leaving a tumor. So that 10%, that is called last mile problems.
Last mile.
Problems.
I'll tell you-
90% tumor you remove nothing. When you try to that, suppose I have seen I don't know, my professor Dr. Banerjee. So he used to have a very perfect surgeon.
Sir.
So he will try to remove last milligram of tumor.
Oh.
So one patient he was operating. It was a tumor around the hypothalamus attached to the basilar top. So I was hanging around. I said, sir, I think this is attached to a big vessel, don't do anything. Say, let me try microsurgically. Micros, what will happen? If bleed, I'll put a clip. He pulled that out and the basilar artery ruptured.
Oh.
And basilar artery rupture, you can make a volcano. And see, you are under microscope, and it looks that he has bled 1 liter. And then where from is bleeding, we cannot see. The area which is bleeding is under the depth, and you are surface.
One of my
Then I said, sir, what you can quickly do, expose the neck, clip the arteries, reduce the blood circulation so that we clip here, blood circulation goes down. Many times what we do, very vascular tumor, we expose the carotid artery there. We put tape. Nowadays not very much done because we rather leave tumor than creating problems.
Correct.
We know that very good radiation, gamma knife, X knife, IMRT. So why risk life?
Exactly.
So, but I have seen several times.
Sir. Here, one thing I'll tell you, like my father had a cardiac surgery in 2006. Dr. Pradyut Rath, he is one of the team member of Dr. Ramakant Ponda.
Pradyut Rath na Pratap Rath?
Pratap Rath. Pratap.
He was in Hyderabad.
No. Pradyut Rath, sir. Pratap
So,
Rath is in cardiology in
cardiology
Hyderabad. Pradyut Rath is a cardiac surgeon.
at Bombay,
Bombay,
Pune, Bombay.
Asian Heart Institute. So my father was kind of having oozing from the, and I was a bit worried. So he came out from the OT to tell me, and then I told sir, bleeding band hoga ki nahi? And as doctors also, we'll have more. Yeah. So then he told, Madaku Mahadev Dorante. Same like that for bleeding. Any bleeding will stop with pressure.
Pressure.
So
Actually, what
I was
happened?
remembering that thing when you
Actually,
were
what
telling
happens
me.
when you're tired, you do not even wait for 5 minutes.
Sir,
Every large bleeding, if you press for 5 to 10 minutes, it's going
correct.
to stop.
Stop.
Okay. So, but we are so intolerant, impatient, or because you want to quickly go out of the operation theater, you have to spend 10 hours in the morning.
And we some many a times the surgeon also feels if I put a stitch or something, it will close early.
They think by surgical technique can do it. Why unnecessary
Why?
put old age old technique?
Correct, sir.
Pressing and putting, that is age old. Hand get caught. What to
Sir,
do?
sir.
You tight or press it. Ne? So that is age old technique.
Sir.
So because doctors think that they can still do technically stop it, they try. But I mean, sometimes okay.
I think, sir, we can talk for hours together, but
Every
your
topic is interesting,
sir,
and there is endless discussion.
we will sir again catch up again. I will take appointment with you again, and I think we will have more elaborate discussion on many things. And as the time constraint, you have
I
a
know, I know.
surgery. We will end this discussion here, and
So nice
I'm
of you.
so glad, sir. We had really very fruitful discussion, and our viewers will be very much. It will be very helpful for them.
I'm sure it was a very interesting discussion. We talk like a, not like a scientist and a discussion. We talk like a very cordial atmosphere
Sir.
with the general
I think
topic
this must
life.
be your first interview with a doctor.
Yeah, we have the interview with doctors, but they are pointed question to a topic. It's not
Sir.
like a life, social, philosophy, embryo, brain development.
Sir,
It's a we talk in a broad-based topics.
Sir.
So if you talk a pointed topic, doctors come, not like you. Because you have a lot of experience, this is a different type of discussion.
Thank you very
Thank
much,
you.
sir. Thank you
God
very
bless
much, sir.
you.
Thank you very much for hearing this to the end. And again, I will request you to please do subscribe to the channel. And thank you very much.
Thank you.